That is, the topic is zygomatic complex fracture. Zygomatic complex fracture, that is part 1. We are going to discuss the introduction, the clinical features, and the radiographic assessment of the zygomatic complex fractures in this part. Let's start with the introduction. Zygomatic fractures are common facial injuries. It is most common facial fracture of the second in frequency after nasal fractures. The high incidence of zygoma fractures probably relates to the zygoma's prominent position within the facial skeletal. The zygomatic buttress, it is a major buttress of the facial skeletal and principal structure of the lateral midface. We are talking of the lateral midface. This is the lateral mid part of the midface, and it is the principal structure of the midface. It is a thick, strong bone and is roughly quadrilateral in shape. It is roughly quadrilateral in shape with the outer convex and the inner concave. It has temporal, orbital, maxillary, and frontal processes. It articulates with 4 bones: the frontal bone, the frontal bone, the maxilla, and the temporal bone. This is the anatomy part. The zygoma is 4-sided pyramid. It is tetrapart configuration, lends itself to complex injuries as fractures here rarely occur in isolation. Here we are able to see you the various processes. The one is the frontal process. This is the one, and again we talk of these two. It is zygomatic-maxillary buttress. This is the 2 region. Third is the infraorbital region. This is the infraorbital rim we are talking of. Fourth is the zygomatic arch, and fifth is the lateral orbital wall, which we are talking of. So these are the various processes through which the zygomatic bone is suspended or attached to the skeletal system or the middle third of the face. We are talking of zygomatic bone again, showing sites of muscle attachments and various aspects, that is the lateral aspect and the medial aspect, and the other processes which we have talked earlier. Also the frontal process, this is the maxillary process, and so on. We have talked regarding the anatomy part. Now we come down to the terminology and fracture pattern. The malar bone represents a strong bone on a fragile supports, and it is for this reason that though the body of the bone is rarely broken, the 4 processes, the frontal, maxillary, temporal, are frequent sites of the fracture. This was given by S.D. Gillies, T.B. Kellner, and D. Stone in 1927. Biomechanics of fracture. The fracture pattern of any bone depends mainly on the direction and magnitude of the force. The fracture lines pass through the areas of greatest weakness of a bone or between bones. The inferior orbital fissure is the key to remember the usual lines of zygomatico-maxillary complex fractures. This is an important point. That is, the inferior orbital fissure is the key member, the usual lines of zygomatic complex fractures. 3 fracture lines extend from the inferior orbital fissure in an anteromedial, a superolateral, and inferior direction. These are the fracture patterns in case of zygomatic complex injuries. This is the frontal view.